welcome back to Aspire Education OET. Today we will be doing the listening and the reading subtest. I hope everyone's fine. So if you have any queries or any kind of questions that you want to ask, please email us at oet@aspiretoplab.com or info@aspiretoplab.com. We have an OET dedicated WhatsApp group. The number is +91 8105 966 999. And these are our social media handles. Our website is oet.aspiretoplab.com or www.aspiretoplab.com. And we have a dedicated Facebook group under the name Aspire IELTS/OET. And you can even find us on Instagram, Aspire to Education. So my name is Dr. Anushree Chandra, and I will be handling both the modules today. And we will be doing the listening module first. So this module will introduce you to the OET listening test. It provides information about the format of the listening test and what the test is designed to assess. You will learn about all the different questions types used in the listening test and the skills and test strategies that help you perform successfully as possible. So let's start with a few important basic facts about the test. The total length of the listening audio is about 40 minutes. This includes the recorded speech and the pauses that allow you time to write down your answers. You will hear each recording once only, and you are expected to write your answers while listening. The listening test is organized into 3 parts, namely A, B, and C. And in each part, there are different types of question and different types of tasks. So there are 42 questions in total. And part A consists of 24 questions. And you'll have 12 questions each for each extract. So that's basically 2 extracts for 24 marks. And your part B will have 6 questions with 6 extracts. So basically each extract will have a question. And part C will have 2 extracts and 12 questions. So the topic of the listening module is pretty generic because this will be the same paper across every profession or platform. So the topic is going to be of generic healthcare interest. Right. So let's look at the listening structure. So the OET listening test is designed to assess your listening skills in a range of contexts relevant to your workplace. Each part of the test focuses on important areas of understanding for healthcare staff, including communication with patients and colleagues in the workplace environment. So the ability to understand and record important information in a work context is also assessed in some parts of the test. So let's look at the listening question types. So there are 2 possible question types in the OET listening test, and it is useful to consider the design and format of these tasks so that you can improve your test performance. Basically, the more you know about it, the better you can perform. So let's look at part A. In part A, you will listen to 2 recorded healthcare professional patient consultations. And the type of task that follows this is called the structured note completion. So basically, you'll have to write the answer or fill the answer with a word or a short phrase. And you will have 30 seconds of reading time before the audio clip starts. So yeah, let me just show you a sample of it. So this is how the part A question paper would look like. So basically, you'll have around 12 questions for each extract. So yes, and you'll be given 30 seconds of reading time, and then they will start off with the audio clip. So this is the part A sample. Part B will have short workplace extracts. So they'll be about a minute long, and it will consist of 6 unrelated monologues or dialogues and one MCQ for each extract. So you'll basically hear a clip, and then you'll have one question with say a 3 choice or a 4 choice MCQ under the question. So you'll for part B, you will have 15 seconds of reading time for each question. So part B will look something like this. So there will be a piece of conversation and there will be a question, and then you will have multiple choice to pick from. And then you will hear a different extract or a conversation between two healthcare professionals or monologue, anything. It could be anything. So then you'll have a question, and then you'll again have 3 choices. So let's look into part C. So part C are your presentation extracts. So they're about 5 minutes long, and you'll have 2 different extracts, and you'll have 6 multiple choice questions for each extract. So that's basically 12 questions. And each recording will be heard only once. So please write down your answers as you listen, because you will not be given any extra time to transfer these answers onto your answer sheet. So let's address a few FAQs, because these are the kind of questions that I keep getting from OET candidates, and I thought why not address it here so that we have a little more clarity. Do I have time to check my answers for the listening subtest? Yes, you will have about 2 minutes at the end of the subtest to check your answers for all the 3 parts of the subtest. And yes, you will listen to each part only once, so you must write your answers in the question booklet as you listen to them. Do I need to write down exactly what I hear? In part A, the consultation extracts, you must complete the notes using the same phrases or words that you hear or as they appear in the recording. So you should not paraphrase it, or you shouldn't change the information that has been told in the audio clip. So why are various accents used in the audio recording for the OET listening? They use like a range of accents to reflect the global nature of the healthcare workforce. So the main accents that you will hear are Australian, British, and American to one extent. And you can even hear, other varieties such as New Zealand, Irish, or Canadian, etc. So that is just to reflect the real workplace scenario, because you will meet people of different places, different culture, and yes. So where do I write my answers for the listening subtest? So for part A, you must write your answers in the space provided in the question booklet itself. And for part B and C, you need to shade a lozenge next to the appropriate answer. So how is the listening test scored? Part A, it'll be double marked by OET assessors. And for part B, it is computer scanned and automatically scored. So do I lose marks if I give incorrect or extra information in the listening subtest? Well, there is no penalty as such, like there's no negative marking, if that's what people address it as. So, but you cannot, but if you will lose marks if you contradict yourself or make your meaning unclear. So do I lose marks for spelling mistakes in the listening subtest? In the listening subtest, you will not be penalized for misspelling, provided the meaning is clear. A range of spellings are accepted, say US or UK spellings. They're all accepted, but please try to be consistent. So once you start using British English, like I mean the spellings of UK English, don't again try to switch back to US English. So just try to be consistent. So names for conditions and medications are often difficult to spell. So we try to ensure that candidates are not disadvantaged by this. So wherever possible, they do make a reference in the audio clip. They spell it out for you if the spelling is pretty complicated. If they don't, and if you give the closest answer possible, they might consider it. And this rule applies only for the listening subtest, and because they treat spellings differently in reading, and I will get to it in the next module. So what I'm telling now, this is just for the listening subtest. To one extent, they do accept it if it's a medical terminology or a really difficult condition name or a drug name. But when it comes to grammar, say normal English words, yeah, just try to stick to either UK or US English. But both are acceptable. So how many questions do I need to get correct for the listening subtest? This was one of the most asked question. So yeah, the number of marks needed to secure a grade B will always vary because they might change the number of questions depending, you know, on test. But usually to get a grade B, that is a scale of 350, you will have to score at least 30 marks. So that's like 30 out of 42. So now that we have that sorted, let's look at a few strategies or say tips and tricks as to how to go about this and get as many answers as possible right. So in the OET listening test, you need to use your time efficiently. You will have 30 seconds reading time before the audio clip starts in part A. So you will have to skim and read the text. You need to use these 30 seconds very effectively. So please practice skimming. Skimming is one of the way you go about these questions. So when you skim a particular passage or questions and answer, you don't exactly read for the meaning. You just try to what do you say? Try to grab on or try to hold on to the uh, words that actually signify something, and you ignore articles like a, and the, and yeah, you just try to pick up what might be important or what you should be listening to, what is important according to you or according to the passage that is gonna that you're about to hear. Next is using the headings. So the headings which divide the notes are extremely important when you are preparing for and when you're preparing for and completing the questions in the listening part A especially, because they can help you keep up with the flow of the talk and as well as predict the direction the conversation might take. So let me just go back to the sample paper to tell you what I mean. So yeah, so this will be your part A, and these are the headings. Always use this as the guide. In case you skip a question, you are not able to hear it, and say you're not able to answer it, then the minute they say, we will be discussing about the occupation now. So just skip to the occupation part and like use this as a guide to take you through the test. So pay special attention to these headings because they guide you through it. All right, analyzing the gap. So it is important to practice analyzing the questions as you prepare for the exam so that the skill becomes more automatic. Uh, and to be honest, analyzing the gap, this comes, what do you say? This comes much more easily to people who have uh, better vocabulary or a hold on grammar. But it's not something that others can't pick up. It's like the more you practice, the more you perfect the skill. So what I mean by analyzing the gap is, you should be, when you go through a question, you should be able to, tell whether it's one word or a short phrase or two words, or if the answer is going to be in singular form or a plural form, because, uh, yeah, when they say, for example, when they say these, THESC, so you're expecting two words there. So the answer is going to be like either say two words or something in plural. So you should be able to guess this. And this comes by practice. It's something very useful. because it kind of tells you, it gives you this sixth sense whether, an answer is going to be right or wrong. So, synonyms. So, pay attention to non-medical terms, because when the patient is describing something and it's a part of the question, he might be using synonyms. It might not be the exact medical terms that you're expecting or that is in the answer options. So always pay special attention to synonyms. Paraphrase. So you will always encounter paraphrases, whether listening or reading, both of them, in fact. And yeah, they might be using completely different words or say words with opposite meaning. So you just need to be a really good listener. Before I explain this whole, let me just tell you the most important point is that the answer is always given by the patient. Say in a consultation extract or say a two-person question and answer extract kind of situations, you will always get the answer from either the patient or the second person who is, giving the information basically. So that is where you concentrate more, or what do you say, focus for the answers. And you can always use the healthcare professional words as a guide. Again, it'll be the headings in the sample paper. So all of this will be told by the patient. So focus on the patient's words rather than the doctors or the healthcare professional, or the first person who's basically questioning. Well, that doesn't mean you ignore the first person. They help you, you know, take the conversation forward. But yes, it's always the patient who gives you the answers. So listening while reading, this is something again you pick up by practice. As you're listening, you should be able to read ahead of the audio recording. Say read the question ahead, so that you're expecting the answer and you're prepared for it. So when answer is meant to be in singular form, you should write it as it is. Don't add an extra s, or if the answer is a plural form, do not forget to add the s. And don't go into unnecessary capitalization. Like sometimes people have the habit of, when they're writing down the answers, they tend to begin the answer with a capital letter. So if the word happens to be in between a sentence, do not capitalize. Write it in small. Don't panic if you miss an answer. This is the most important thing to remember, because it's all right if if you weren't able to get an answer. Just move on to the next. Let the headings guide you. Because if you panic, you're gonna miss the rest of the answers as well. It's better to miss one answer and get the rest right. You know what I mean? So always practice as much as possible before your actual test day, because the more you practice, the more you orient yourself to the accents, and you know where to look for an answer, and you'll in general get an idea as to how to go about the paper. So here's a little task. So uh, as I said, the patient will not be using medical terminology. So there might be instances where, the question will be in medical terminology and the patient is saying in layman terms. So here's a little task. So match the technical terms with the more common synonyms. So here are your technical terms or medical jargons or words. And here is what I want you guys to do. Please take a pencil or a paper, or if you can do it just like that by looking at the screen, even better. So let me just give you 10 seconds and you guys can enter the answer in the the questions box. Is my voice clear? I just looked into the text box, and is anybody having a problem with the audio? All right, thank you. So, assuming that you guys answered, I'll be giving you the answers now. So hopefully everyone got that right. Let's move on to another task. Paraphrase, because it's really important. You will have to paraphrase both in listening and in reading. But for part A, write the words as it is. So please match the phrase with its correct synonym. So these are the 4 synonyms. And here are your options. All right, so let's just go back to the previous in case you guys didn't get the answer. All right, we have somebody who has answered it. 1C, 2B, 3F. Laura, all right, you've got all of them right, so that's good. So here's another simple task. So these are the kind of terms and phrases that we usually hear, so it shouldn't be that difficult. So let's see the answer. Here they are. I hope all of you got them right. Yes, A is localized, B unconscious, C treated for, and D is tested for. Right again. That's great, guys. So now that you guys are ready for a practice session of the actual listening module, let's move on to that because practice makes a man perfect, right? All right, so let me just play it from the beginning, and please try to answer these questions, right? Try to write it down on a piece of paper so that we can cross-check in the next slide. All right, so I'll be playing it now.
Davis, I understand your GP has referred you to me so that we can review the medications you're taking for your gout.
That's right.
So, tell me a bit about this gout. When did it start?
Well, my first serious attack was last year. My wife and I were on holiday and I woke up one morning with a really bad pain in my left knee. Well, I never thought of gout because I always assume that just happens somewhere like your big toe. And anyway, I'm only 40. I thought it was something only old people get. So anyway, it was all red and swollen, and I decided it must be an insect bite. But I couldn't think how that might have happened, without me feeling something at the time. Well, my wife suggested it might be something to do with the pills I take for my cholesterol.
Unlikely, I think.
But anyway, the pain didn't get any better. In fact, quite the opposite. I started to get frightened because I thought it might be a sign of something really serious. It was excruciating. So my wife thought I needed to get some help. So she phoned the local clinic and told them about my symptoms. They told her to bring me in. It was a good thing she was there. I was in too much pain to drive. I mean, I could only just manage to walk from the house to the car. Anyway, when we got there, the doctor took a look and said he wanted to take a blood sample. He said it might be an emergency because it looked as if it could be septicemia. So then we got really frightened. But about an hour later, they came back and said, no, it wasn't, thankfully. But they thought I had gout. So actually, at that stage, we were quite relieved.
Yeah, I can imagine.
And the doctor asked if I'd ever felt anything like it before. Well, actually, then I remembered that in the winter, I played quite a bit of rugby and sometimes I'd get some soreness in the same place the day after, but I just thought I'd sprained it or something. And it would go away after a couple of days. But this pain's much worse, and it comes even when I've been resting. I've had it quite a few times since my first attack.
Right. So, what have you been taking to deal with the pain?
Well, at first, the doctor at the clinic suggested I took some anti-inflammatories, but I can't say they made much difference. So when I got the next attack, I was at home and I went to my GP. She suggested I took, I can't remember the name, Col something.
Colchicine?
That's the one. So that dealt with the pain better, but it gave me awful diarrhea.
Yeah.
I'd never take it again. And then I had a really bad attack. I think the doctor had got to the stage where, she was already giving me really powerful medicines to no effect. So she gave me liquid morphine to take. It made me feel quite sick, actually. And I was a little bit away with the fairies, walking around not quite knowing where I was.
Right. Did you try any other sort of treatment apart from the medications?
Yes. My GP said I could try using an ice pack, and that did make a bit of difference, but you can't have it on all the time. So anyway, after that, she said, let's try allopurinol, see how you get on with that. So I started taking that, but I didn't get on with it. It gave me a skin rash. So I rang her up, and she told me to stop taking it, that I'd better see a specialist. So here I am. Is there anything more you can do?
Well, I'm sure we can find something, maybe
Alright, so that was the end of the audio clip. Let's go to the answers. To those of you who made an attempt, so here are the answers. So please cross-check. So here's part B, and I will be playing the audio clip for this one question here. So this is how the rest of the questions will go in part B. So this is just to give you guys an idea so that you guys can perform better and know where you stand.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
So guys, that will be the basic instruction given to you before a different part starts. And now we will be playing the actual audio clip for this particular question.
Question.
Hi, I'd like an urgent appointment, please.
Let's see, who's your usual dentist?
Mr. Garcia?
You say it's urgent. Are you in pain?
Yeah, it's the tooth Mr. Garcia filled last week.
Well, he's away today, I'm afraid, but there's a free slot this afternoon with his colleague, Mrs. Brown.
Well, that'd be okay, but are you saying Mr. Garcia could fit me in tomorrow?
That's right, we get you in first thing. Can you wait?
Well, I'm not chewing on that side and I'm taking paracetamol, which is helping. The pain started when I was eating a steak, so I'm frightened I might have upset Mr. Garcia's work. It makes sense for him to check it out.
Okay, we'll book you in for tomorrow morning at 10.
So that was the audio clip for this particular question. Anybody with the answer? I can see that a lot of you have been answering. Congratulations to all those who got it right. I can see a few questions as well. I will be addressing this at the end of this listening module, so please stay patient. A is the right answer. Congratulations, Suhas. Yes, and a lot of others who've got it right. So now that you have an idea as to how the listening module goes, so this is how part C would look. I've just added it here so that you guys know how the paper looks. Except this time it won't be a short clipette. It will be a 5-minute long, either a conversation or a comprehension that will be read out. Thank you so much for attending our listening webinar. Please email us your queries on oet@aspiretoplab.com or info@aspiretoplab.com, and our website is oet.aspiretoplab.com. We have a dedicated WhatsApp group for OET discussions. That is +91 8105 966 999. All right, so let me just address a few questions. I can see a lot of people have answered. Congrats again, and I'm really glad that you guys could squeeze in some practice. Thank you so much.